Negros Oriental is a quaint province located at the southeastern portion of the Negros Island region. Known for its natural beauty, laid-back atmosphere, and friendly locals, it has become a favorite vacation spot for tourists and nature lovers alike. So it's no wonder that its capital city, Dumaguete, was named by Forbes magazine as one of the 10 best places to retire overseas in 2014.
But underneath its beauty lies a hidden danger. A deadly infectious disease is slowly tarnishing its social structure from within. It has crept into the communities, often undetected, infecting younger and younger individuals in its wake. It's the dreaded HIV or AIDS, and the province has been fighting an uphill battle with it, though behind the scenes.
Why is it happening? What is the government doing about it? And is the province having an HIV/AIDS epidemic?
These questions, though straightforward, don't lend themselves to easy answers. But before we seek for answers, we must first know the facts.
According to Centers for Disease Control and Prevention, HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome, or AIDS. Unlike some other viruses, the human body cannot get rid of HIV. That means that once a person has it, he or she has it for life. HIV is spread mainly by having sex with or sharing drug injection equipment with someone who is infected with it. HIV, however, cannot be spread by casual contact, such as hugging or shaking hands. Untreated, HIV is almost universally fatal because it eventually overwhelms the immune system, resulting in acquired immunodeficiency syndrome, or AIDS. AIDS is the stage of infection that occurs when the immune system is badly damaged and the victim becomes vulnerable to infections and infection-related cancers called opportunistic illnesses.
The worst thing about HIV or AIDS is that it doesn't manifest any noticeable symptoms, and the only way to know for sure that someone has it is to get tested. Some people can even go as long as 10 years without showing any signs that they have HIV or AIDS.
As per the UNAIDS Global 2010 report, the Philippines is among the 7 countries in the world with the highest incidence increase of HIV at 25%.
And Region 7, a region that Negros Oriental was a part of before the Negros Island region was created several months ago, is considered a hotspot. That is because the total HIV positive cases in 2011 to 2013 surpassed the total number of HIV cases documented for the first 25 years since the virus was first discovered. Among 4 provinces in Region 7, Negros Oriental ranked 3rd in the number of persons infected with HIV or AIDS. And since 1984 up to the present, there have been 46 cases of HIV/AIDS documented in the province, 6 of which are considered to be full-blown HIV/AIDS cases.
During the first quarter of this year alone, 5 new cases of AIDS were recorded, with 1 already manifesting the AIDS disease.
These are pretty damning facts, which make me wonder, why isn't it getting the attention that it deserves? Aside from sparse reports from local newspapers and radio programs, the general populace doesn't get to hear much of it or anything at all.
So I made several phone calls just to secure a sit-down interview with someone living with HIV or AIDS. But since the topic is very sensitive, nobody agreed to do so. However, I was able to talk with someone infected with HIV over the phone, but with the condition that the conversation can be recorded. So obviously I can't use the information that I got from that conversation here. So what I did was I just used the things that I've learned from that conversation and use them as a guide for my research and for my interview questions. So Blue, thank you for sharing your story and for trusting me. It has helped a lot, really. To uncover the truth, I sat down with Mrs. Christina Dagle, the STI HIV/AIDS coordinator of the Integrated Provincial Health Office of Negros Oriental. I have a news article here from the Freeman written last May that said there's been a steady rise of HIV/AIDS cases in Negros Oriental. And at the time it was written, there were already 46 cases of HIV/AIDS in the province. Do you agree with this information?
Yes, because the information came from the National Epidemiological Council in Manila. But as for me, I have only 3 identified HIV cases.
So, what are the factors that contribute to the upward trend of HIV/AIDS cases?
I think it's more on male having sex with male without any protection, because we know already the MSM, or the male having sex with male, they're doing it through anal sex without any protection. Also, I think the injecting drug users, because we cannot really force them to give them voluntary testing on HIV. I think here in the province, it is just really minimal compared to other cities, like Manila and Cebu, because some people just, HIV, we don't have it here because we are gentle people like that. So, but we're not sure.
What is the government doing about it, and specifically the IPHO, and what's the role of IPHO in all of this?
Actually, in the national, they are targeting the megacities, as I've said. But here in Negros Oriental, the Gender and Development Program, have their budget for those HIV program. I'm handling that one, so I asked for them some of the percentage of the budget to have drugs and medicines for sexually transmitted infection, and for those person whom I know that they have HIV positive, because they have every now and then they have some infection. So if possible, I could give medicines to them.
Is the HIV/AIDS testing subsidized by the government?
In our situation here in Negros Oriental, we have a hack team in the hospital. So it is composed of a doctor, nurse, medical technologist, and a social worker. So if ever a person needs a HIV test, we will go to the social worker, and then she will be the one to counsel, because we have a pre-counseling and a post-counseling. We give it for free. HIV is really one kind of, I think, it's not sickness. We want the public to know that we will really help that person.
Now, what are the challenges that you're facing in implementing HIV/AIDS related programs?
My challenges are the LGU. Really, some of them are not really does not want to have the political will on HIV and AIDS, because they think that no cases in their municipalities. But I think the LGU should be aware right now that cases are rising, but some of them will not disclose or will not appear as, because due to the stigma they have on themselves. We should tell the public the information about HIV and AIDS, and then I hope they will understand the situation of that person with HIV and AIDS, because it really needs support. And to tell you, some of the HIV positive person, even their relatives, don't understand them. They really, if they know that they are HIV positive, my God, they will disappear.
What are the laws that protect the privacy and security needs of people living with HIV/AIDS?
Okay, we have the Republic Act of 8504 of 1998. It stated there the right and the rights of the HIV/AIDS positive, and then it also stated there all the access and information, and it really if you really read the law, it really protects the confidentiality. I hope and pray that in the future the cases will go, like our target is getting to zero. Hopefully, through the campaign around the world about HIV-free world, we can get that, because I think we really lack support, information, and understanding on people with HIV.
I've also talked to people around the capital city to get their opinions about this issue.
Ryan Gallagher, I'm 29 years old and I work in the gold mines. I'm a contractor.
Are you aware that there's been a steady rise of HIV or AIDS cases in Negros Oriental?
Yes,
Where did you hear it from?
mostly in morning news, local news. HIV and AIDS are getting high here.
Just everywhere in the public.
They still they lack information for people about the disease, the virus, and I think they need more.
Do you think the government is doing enough to address the issue?
They're doing as long as they can, the best they can, but still they still lack lots of resources for, like, the medicines for the victims, and yeah, the information drive for the people.
One of the modes of transmission of HIV or AIDS is sharing of needles. As a tattoo artist, what safety precautions do you take to ensure that it doesn't happen?
My stuffs are mostly all of needles and the tips, and I use a lot of precautions, and needles are shared. It will share disease as well.
So after you've done the tattoo, you throw away the needle?
Yeah, all of it.
All of the
Yeah,
time?
all the time, and it's very rare on professional tattoo artists use needles twice. Yeah, because it's very dangerous.
Are you willing to help the government in their campaign against HIV?
Yeah. Yeah, so
In what way?
teaching people, the kids mostly. Yeah,
Teenagers?
yeah. Inform them about safe sex, take precaution, and yeah, educate themselves. And
Just take precautions. Think. First of all, if you're bleeding, that's how you get it.
What is your final message to the public?
Can I read my message?
Yes, ma'am, you can.
To successfully prevent STI, HIV/AIDS, we need to modify how to deliver services and accept our responsibilities. In this process, strong leadership, innovative thinking, partnerships, and adequate resources will be needed. All individuals, regardless of race, color, creed, and socioeconomic status, are vulnerable to HIV/AIDS. HIV/AIDS can have a devastating impact on individuals and communities, but responding to HIV/AIDS can also bring people together.
The measure of a true democratic society is the way it takes care of its citizens, especially those who are marginalized. It is the duty of the government to provide a safety net for those people living with HIV or AIDS, but it's also the responsibility of every healthy and fortunate citizen to treat these people with dignity. There might not be a cure for AIDS for now, but there sure is for ignorance and indifference. Educate yourself. Spread the compassion and not the disease. For Undead News Network, this has been Churchill P. Guevara reporting.